Hello, and welcome to the Fisher Institute of Health and Wellbeing, the Healthy Lifestyle Center. My name is Lakeisha Johnson, and today I'll be discussing with you the importance of exercise after surgery. When you think about recovering from a surgery, usually people think about lying around all day in order to get your mobility back, in order to get your energy back, because surgeries and major invasive procedures take a lot of energy out of you. They take a lot of your range of motion out of you, and oftentimes people wonder if they're going to ever recover back to the state that they were before, or if it's just a surgery or procedure that will just get them by or through their current situation or problem. However, exercise has been shown in many research studies to be able to allow for not only a remarkable recovery, but a recovery that is quicker than normal when you're only sedentary, and a recovery that enables you to be the best, to welcome the best outcome for you. So jumping into a fitness routine post-operation with no planning raises the chance of injury for sure. And it can be scary because it's very physical, it's very intensive, and it requires a lot out of you that you wouldn't think that you had post-operation. However, when you're doing that by yourself, that can be the scary part. However, when you're with trained professional and medical practitioners, it's actually extremely beneficial for you to include an exercise regimen into your program. Here are some of the reasons why it's important to exercise after a surgery. For starters, exercising after a surgery allows you to prevent further injury or other injuries in different areas and decrease your recovery time. So by working with a physical therapist, a trainer, and your medical practitioner who either referred you to the operation, is your regular family doctor, whoever it might be that you're continuously seeing for your regular checkups and health, and specialized requests for their health, for example, like a cardiologist, will help you prevent further and future injuries and speed up your recovery time. So resting too much post-op can hinder your recovery. So for example, a long bed rest after a knee surgery will actually weaken the supporting muscles around the joint and actually increase your risk of injury. From experience, I've heard from testimonies from people who have actually just recently got a knee surgery, and this has caused them to, because they were sedentary, this has caused them to have a lot of stiffness in their joints. And so getting into a gym, getting into a fitness center has allowed them to have greater range of motion and push themselves to further a limit than they thought they would be able to. I think oftentimes when we work alongside another professional, instead of just going in by ourselves, they can often push us and hold us accountable to our physicality more than we can, because sometimes we'll quit early, sometimes we're scared, a whole host of just fears run through our minds. And so being able to work with someone professional is very key in order to be able to prevent other injuries and decrease your recovery time. Specifically, working with these trained professionals will allow programs and should be designed to work with your recovery to prevent the injury, but also include ensuring strength and mobility in that affected area. Mobility and strength are the key things in terms of recovering in that specific area that you had a surgery procedure done. So specifically, as I mentioned before, asking your doctor for a referral to a physical therapist and specifically finding a personal trainer who's experienced with recovery programs. Because just because someone is able to train people in general doesn't mean that they're able to train people who are recovering from surgery specifically. And so you want to be careful and do your research before. And so this is something to include in your program if you know that you're going into a surgery, to be looking ahead, not just wait until you have that surgery and then begin to look. It should be a process that is ongoing and should be a conversation between multiple professionals. Next, staying sedentary will impede your health in other areas. So staying sedentary, as we know, regularly, even without having a surgery, compromises your overall fitness level, and so it can affect your weight, blood pressure, mobility, strength, and more. By affecting those different areas, we know that deteriorates our health even further. And so a focused program will prevent those outcomes, because overall fitness and exercise in general works to counteract and increase those skills and counteract those comorbidities. But being able to add on to the ability to rehab is also an added plus for people that are recovering from surgery. Research has shown that even pre-surgery exercise enhances post outcomes. And so oftentimes our health outcomes, or there's health outcomes and benefits preemptively for recovering from a surgery if you are exercising routinely before you go in. So for example, exercising after surgery prevents blood clots that can form after vascular or hip surgery and can be fatal. However, if you are exercising before then, blood clottage and the ability to form strong vasculature and have less vascular resistance in your arteries and veins is one of the benefits of exercise. And so overall, programs can and should be designed to work with your recovery to once again prevent injury and ensure strength and mobility in those areas, but also help you decrease some of these other outcomes that might affect your health as well. So overall, I hope that you all are learning and are convinced, but also go out and get some more research on how exercise will improve your post-operation health outcomes. If you try to work on your own, you risk healing improperly or neglecting areas that require attention. And so please work with other professionals in order to ensure that your recovery from your surgery or even pre-surgical outcomes are in the best hands possible. Having a trainer and a doctor working together means you'll know which exercises are best for you and how to best do those. A trainer might not know what a doctor knows, and a doctor might not know what a trainer knows. And so having a team of professionals is better than having one single individual. And so that you can get multiple opinions and multiple ways to deal with your recovery. For more information, please look at the information here, and we hope to see you soon in our center. Thank you.